Hi, welcome to My Pets TV. I'm Dr. Donna McWilliams, and this is my friend Abby. And today we're going to talk about the importance of preventative health care. Everybody who has a pet knows that having a pet can be really expensive, and we often want to look for ways to cut costs. And you know, everybody usually knows that, oh, it's once a year, time to go to the vet and see about getting Abby's shots done and things like that. Well, vaccines are certainly an important part of keeping a pet healthy, but they're not all of it. So if you happen to buy those vaccines online or at a feed store and you give them yourself, or somebody just real quickly pops them in, you may be missing some really important things. A veterinarian is going to give your pet a thorough tip of the nose to tip of the tail exam, and that's really, really important, and it can be so critical. We've saved many lives by discovering things on a physical exam that otherwise would have been missed. So first and foremost, when you come to the vet hospital, your vet's going to listen to you, and we want to hear about any complaints that you may have about your pet's health, any concerns, questions about their behavior, and it's time for us to have those conversations, and that's important as part of the visit. And then next, of course, while we're talking, we may start that physical, and we look at those nice bright eyes, and we look importantly here and all the way back here at these teeth, and make sure that they're healthy and that we don't have plaque buildup. Dirty mouths can really, really wear on the health of an animal, so that's a huge part of the physical exam, is preventative dental health. Ears, we want to definitely look in there, take a whiff, see if we have any of that odor that might indicate there's an infection or any redness. We want to go through this coat, and we want to run our hands along and feel for lymph nodes or for any lumps and bumps that might be there. We want to look down in these toes as well. Every vet will do this a little bit differently, but they should go head to toe. We want to feel that, and then we of course want to listen to that heart and make sure that we don't have any issues here. Murmurs, different rhythm sounds, those can be important parts of the physical that if they're not identified, they can really, really have a tragic impact on your pet's health. Skin, something really big here in our part of the country, where if we have a skin issue, we want to identify it and get to the underlying cause. We have a lot of those in Florida with the humid climate, and we see a lot of allergies, so that's very important. We also want to feel that belly, make sure those organs are normal and that we don't feel any scary lumps or bumps there. And then of course musculature, we want to feel hips and thighs and knees, and make sure that some of those breeds that are prone to having problems back here, that we address that before it gets to be too bad. And then unfortunately we got to look back under here too, make sure there isn't any issues there. So the physical exam is one of the key parts. We usually ask to do that twice a year here at our hospital, because guess what? Your pets on average will age about every, for every 12 months. That's about 4 years. So if we see them every 6 months, it's only every couple of years in their lives. So not too much to ask. So that's a big part of our preventative health. We also do wellness screens to make sure that they're as healthy on the inside as they are on the outside. Thanks again. We'll see you soon. Bye-bye.